But just so that you know who I am, I know you see my name. I'm Dr. Candace Brooke. Have been in the behavioral health field, social service field for over 20 years. And I am a licensed professional counselor. I've had my private practice here in Georgia for the last 5 years. I can't believe it's been 5 years, but for the last 5 years. And I've worked with other agencies providing therapy to individuals, families, couples, children. I've done it all, right? And so I have a lot of experience working with individuals who have been diagnosed with anxiety. So that's what we want to talk about now. And I thought this time right now would be the most appropriate time to really talk about anxiety because a lot of people are feeling a bit anxious right about now. So as we go through this information, it'll be kind of like a lecture style. And as we go through this, I want you to communicate like turtle butt. I want y'all to communicate. Type in the chat, like the live, but let's talk with each other about it because again, we're not stressing over this class. We're learning more about anxiety. All right. So that is that one thing I want to do with the 9 people that are in here. So this should be easy. I want us to do a little icebreaker. Tell me what you know about anxiety or what does anxiety feel like for you? If you could just drop that in the chat. What does anxiety feel like for you? And then we'll go more into the definition. Hey, if you just joined in, welcome. I'm going to wait a few minutes. I want to know what anxiety feels like to you. Oh, pounding in your chest, hands shaking, nervousness, absolutely. Like a nervous breakdown, okay? Okay, anybody else? What does anxiety feel like? Tiredness, absolutely. Absolutely. Anxiety can wear you out. And I'm going to talk a little bit more about that. That tiredness, absolutely. That tightening in the chest, racing thoughts, stomach flutters. Yes, I even feel that. The stomach flutters, absolutely. So let's talk a little bit about, and I'm going to scoot y'all a little bit because I got to keep my notes so I can stay on track and don't get too far off my topic or where we are. But anxiety is like it's like our smoke alarm. It goes off to protect us, right? But sometimes it goes off without a real fire. That's what anxiety does. It'll go off and there's no real threat. So we have to be conscious of what is happening within our bodies that causes that alarm to go off. Okay? So giving you, I always like to start with definitions as well. So a definition for anxiety, one is a natural and an essential response to stress or perceived danger. So if you have your, I ask you all to have a journal or a notebook. If you have that, write it down. Because we need to know what this is. Everybody hollering about they got anxiety. But it might not be anxiety, but we're gonna get into that too. But what it is a natural and essential response to stress or perceived danger or a perceived threat. It's a part of our survival mechanism. It's our brain's way to tell us, hey, get ready to face a challenge or get ready to protect yourself, right? So it's not necessarily the enemy, but when it becomes problematic is when it lasts too long. It's overwhelming, it's constant, or it's interfering with our daily life, okay? And speaking about what you just typed in the chat, that you have the tightening. Yes, I'll repeat it. The tightening of the chest, the racing thoughts, the stomach flutters, all those things. I want to talk about how we were wired to respond that way to anxiety. And that goes all the way back to caveman days or prehistoric days. But I'll talk about that. Stephanie, you wanted me to repeat what the definition? That anxiety is a natural a natural and essential response to stress or perceived danger. Got it? Anxiety is a natural and essential response to stress or perceived danger. That's what it is. It's apprehension, it's tension, it's uneasiness, all as a result of some anticipated or perceived danger. Got it, Stephanie? Okay, so now going back to some of those physical or what we call physiological responses. You're welcome. The increased heart rate, the rapid breathing, the tension, the tightness in your chest, the flutters in your stomach. Again, a lot of that has been pre-wired for us. And I want to pull up, let me move this over here. It was pre-wired. Our brains and our bodies are connected, and we still function in that way, even though we're not cavemen, even though our threats may not be as severe as they were then. Our threats are sometimes very minimal, because they were concerned about lions, tigers, and bears. Oh my, they didn't have a house with a door with a Ring camera to let them know something's going on. They heard a noise and their body reacted. It responded to a perceived threat. And so that increase in heart rate was because the body or the heart was pumping more blood so that the other organs can get oxygen, so that you can have faster movement, so you can either fight or flee. That rapid breathing, again, getting more oxygen in to energize your body for quick movement. The muscle tension, preparing your body to either, again, fight or flee. And then the sweating to help you cool off, because some people experience sweating when they feel anxious, to help your body to cool off after some type of exertion. Another thing that may happen is pupil dilation, so that you can increase your visual perception and see what's going on. And then the last one, the stomach flutters, the digestive system slows down, because it's redirecting the blood to other organs that may need it, the muscles, so that you can run or you can fight or what have you. So again, we were created this way. And back then, that was necessary. That was their alarm system. They didn't have no Ring camera. They didn't have no alarm system in their house, right? So that we needed that. We were created that way. But again, due to evolutionary adaptation, we don't need that, but we still have that in our system, because that's how we were designed and created. So while fight or flight response is helpful for us in this modern day, certain situations may not necessarily require that, because our triggers nowadays, looking at the news, seeing what Mr. Orange Man has said, they're not that life-threatening in the moment, but they are stressors indeed. So we don't necessarily have to have the heart pounding. We don't necessarily have to feel the flutters, but that's how we're designed. So I want to kind of not let anxiety be our enemy, but just to understand it and understand why we're feeling the way that we're feeling. Reese, your anxiety causes horrible GI issues. And it can, because again, and I don't want to go too far off topic, but a lot of us hold our anxiety right here. And I'll give you all some practices to work on so you can notice where you're feeling it. I feel mine usually in this area, my chest. I get the tightness up here, and especially in my shoulders and neck. But our stomachs, oh my God, that area right there. You know how you ever felt like you have a job interview? Let's just say you got a job interview, right? And you're good. You've done this before, or you worked in this area before, so you applied. And right before that job interview, baby, that stomach get to going. You're on your way out the house. You done talked to yourself like, okay, I'm good. I got this. I know what to do. You get to the door and you got to turn around and go boo-boo, right? It will mess you up, because that's where you're holding it. And some things you can do is to learn how to breathe effectively, take in some good deep breaths so you can get that breath all the way down and you relax your parasympathetic nerve. I know, Reese, but trust me, I be feeling it. I've definitely felt that before, many a times. But as we go along, we're going to learn some of those skills to help you to manage a little bit more. And the key to even learning these skills or practicing the skill is practice. We have to practice. You might do it one time and say, that doesn't work for me. I still feel anxious. You probably do. You've been dealing with this for some time. In your chest, Sean. Hey, Sean. Yeah, you probably will still feel it. But the key is practice. Keep practicing. So when I start giving you the skills, keep practicing the skills, because they will start to work. Because what we're doing, I know I do this all the time, not trying to go too far ahead of myself, but when we are deep breathing, when we are meditating, if you meditate, if we're pausing and taking a moment, we are activating our parasympathetic nervous system. And that's the part of our nervous system that helps us to calm down. When we're in that sympathetic nervous system, baby, alarms going off. It's a threat. We all up in here with it. But when we activate our parasympathetic, we learn how to just, okay, let me calm down. Let me turn this alarm off because there's no real danger. There's no real threat. Who is this cutie? And I'm telling your business, girl, all on live telling your business and where your anxiety sits. Well, I'm glad you popped in. We're talking about anxiety and the anxious brain, and we just got started just a few moments ago. Like I mentioned earlier, this is more like a lecture style, but if you have questions or you want to join, you can request to join and we can talk on live because I want it to be very interactive too. All right. And I'm trying not to take you too fast. I just want to kind of go through this and we can sit with it. Uh-oh. Oh, they disconnected. I was about to invite somebody. I want to just go through this so we can kind of sit with it and understand. But if you have questions while I'm talking, feel free to chat, say something and let me know. But I'm sorry, I was trying to check what that said. Some key characteristics of anxiety are what we mentioned earlier, the unease, the worry, and the fear about future events. Now, as I was preparing for the class, now I know anxiety, but I want to have something listed so I can go like in a structured manner. Everything was talking about future events. But I wholeheartedly, with everything in me, know that sometimes we can become anxious about stuff that has already happened. We can have anxiety about past events as well. Example, you were at a party or a gathering. You were over there talking to some people or what have you, and you didn't really get the response you thought you would get, and then you walked away, and now you think, oh my God, did they think I was stupid, or did I say everything right, or and now you're feeling a certain way. So that already happened. That's not a future event. That happened. So my point in saying that is anxiety is not just because you're nervous or fearful of some uncertainty. That's you, Reese. I've been there. But it could be something about the past that makes you a little bit anxious because you're thinking about it a lot and it's causing you to feel some other feelings. And I want to get into the difference between the cognitive part, the worrying, the fear, and the anxiety. We're going to get to that in a moment. But bottom line, anxiety robs you from your moment, from your present. It takes that away. It's either got you in the future, something that ain't happened yet, you don't even know, something that may be possible, but you don't know, or it takes you back to the past. So you're not even living in today. So part of some of the coping strategies and the tools that I want you to gather is how to be mindful and be present in this moment. Sometimes that means interrupting the thought. Sometimes that means changing the channel on what you are thinking about, replacing the thought. Okay, your therapist said that's you having a social anxiety. It depends on the person I'm talking to, I guess. And social anxiety is another type of anxiety. It's one of the forms of anxiety. And we're going to talk actually today about the different common forms of anxiety. It could be a social anxiety, but if you're not always feeling that way when you're in a social situation and it just kind of pops up here and there, it could be what you're telling yourself. So that's another thing I want to talk about. What are you saying to yourself about what you're experiencing? Because our thoughts become our experience and they outweigh what's really going on. And we stay right there with that thought. Whether it's hurting us or not, we stay there. And we got to learn how to change the channel. We can't stay there. Right? It's costing us more harm than good. So back to those key characteristics, a sense of unease, worry, fear about future events, or concern about past events that you can't go back and change, right? The physiological responses, like the physical responses we just talked about, the increased heart rate, the flutters in your stomach, the increased breathing, the rapid breathing, the sweating, all of those are physiological or physical responses to anxiety, right? Have you experienced anything outside of the ones we've already talked about? Any of you? You already told me some of the ones you experienced, but anybody else, if you're just joining in, how has anxiety shown up for you in a physical way? Take a couple of minutes to see, not even a couple, but see if anybody has something to say. If not, I'll come to it when I see it pop up. Sometimes it's a little delay. But again, anxiety is normal. There is some helpful anxiety. So let's talk about that. Some helpful anxiety. Muscle tension, a lot of yes. And I talked about why that is so, because in prehistoric days, like caveman days, that's how our bodies were designed to alert us of a threat. And the muscles get tense because the blood is rushing to those muscles because your body, your brain is telling you it's fight or flight. We might have to run up out of here, or we might have to knuckle up. That's what your brain is telling you. Oh, cutie, really? I hope you're seeing neurologists and getting that taken care of. Okay. Okay. Well, yeah, I think you should talk to a neurologist for sure. Let me say this disclaimer too. I'm not giving any medical device. Okay, great. Good. I don't want to give any medical advice or anything like that. I can share what I can share. I'm not providing therapy. I am a therapist, but this is not what this is. I do have a practice here in Georgia. If you're interested, you can look it up, but that's not what this is. This is just some education about it, okay? All right. So again, anxiety can be very, very helpful. It helps us to prepare, like if we have an exam or if we have a project to do, and we feel a little nerves about it. That's because we care about it and we want to perform well. So that's good. It keeps us alert if we're driving in a storm or something like that. Okay. When we are driving in a storm, it'll keep us alert. We need a little bit of that anxiety, or it might motivate us to get something done because we're feeling a little way about it. So that's good anxiety. We can deal with that, right? When it's unhelpful is when when you can't focus, when it keeps you up worrying at night, you're always thinking about the what ifs, when it prevents you from trying new things, if it causes panic, that's unhelpful anxiety. And so we need to deal with that part. And as we get ready to go into, let me see what, Stephanie, I stutter and have shortness of breath when speaking in public. Oh, Stephanie, are you my sister? Because I feel the same way. I do. I have a hard time with, and I have to stop. I got to change the way I talk to myself about it. And I practice this like in my own daily life. Speaking nice to myself. I got to speak nice to myself. But I do feel what you feel, as far as that fear of speaking in front of people. And I don't know, a lot of times, and I have to ask myself this because I tell my clients, what are you thinking in that moment? And a lot of times I'm thinking, will this be well received? Or I have convinced myself, I'm just not a public speaker. I don't like talking in front. I'm shy. Because really, I feel like I'm shy. I got some friends who might say differently. What did you say, Steph? Naturally, you don't. But when you're speaking in front of a group, I know, I understand. And I do a lot of, I used to do it a lot. I'm a little better now. But I do. I think I'm a shy person. Most people that know me, they don't believe me. They tell me I'm lying when I say that. But I don't care for that part because I do be in my head too much about it. And Cutie, you have testing anxiety. You know what you're doing. When the test is in front of you, panic. And you got to hurry up and get it done. Okay, and there's some practices that you can do, Stephanie, some calming practices and some other stuff. I don't want to get into it right now because, again, this introduction, I don't want to throw everything out on the table at one time. I want to take little bite-sized pieces so we can digest this and we can keep building on it. Because this is just, like I said, the start of your learning about it. It doesn't end here. I want y'all to keep discovering, keep learning, know what is going on within your body or know what's going on with somebody you love so you can better support them. And then you can support yourself. All right. So let's kind of get into Worry versus fear versus anxiety. Because everybody talk, I got anxiety. Oh, you know my anxiety. Oh, girl, I can't do that. That's my anxiety. Is it though? Is it anxiety? It may not even be anxiety. So watch what you speak to yourself. Like, I know I mess up sometimes and I say things that I shouldn't say because I need to be more mindful about what I speak to myself. But I implore you, please be mindful of what you speak to yourself. Do not say, I have anxiety. You're owning this thing and you're putting it on you. I experience anxious thoughts, or I experience symptoms of anxiety, because we all do, right? And I'm not taking away from those who have a clinical diagnosis. They have a diagnosis, but you don't have to own it. I have that. I am that. That's not who you are. You're a human who experiences stress that you've become overwhelmed about, and now you're having anxious feelings, and your body is responding that way. That's what that is. Thank you. But that's what that is. So let's be mindful of that. And I have to consciously do that every day, because sometimes I'll say things like that about myself, and I know better. We all know better. But be mindful of your words, because words are spells. So that's why they call it spelling. Anyway, that's a whole nother lesson for a whole nother class. What's your goal this year, baby? To overcome anxiety. Absolutely. And we can and we will. A little bit of anxiety is helpful. But when it's taking you off of your path, when it's inhibiting you from doing what you want to do and reaching your goals, it's too much. We need to pay some attention. Now, getting back to, is it fear? Is it worry? Is it anxiety? Let's talk about that. Because a lot of times anxiety gets confused with worry and fear. And they're not the same, but they can fall so close together. But let me break this down. I wish I knew how to work live a little bit better so I can have a screen that shows what I'm looking at. It's a chart that I put up. But anyway, maybe somebody can pull them to the side and teach me that. I need that class. But let's talk about this. If you're writing this in your journal or in your notebook, let's look at the terms, right? So worry is cognitive. It's the thoughts that are focused on a potential problem, right? I'm going to take this slow. Worry is cognitive. Cognitive are, your thinking. Your thoughts that are focused on a potential problem. That's a worry. So an example, did I turn the stove off? Did I lock the door? That's a worry. You're thinking about this thing, right? That's all. You ain't feeling nothing. You just having this thought. And it might keep coming. We do have those ruminations, but it's just a thought. But it's focused on a potential problem. That's your worry. Or do I have enough money to pay this bill Friday? That's a real worry. Right? That's a worry. Now, fear is emotional. That's a response to some immediate danger. Okay? That's right now. This is happening right now. I'm scared. There's a big dog right here in my path. He's charging towards me. I am afraid. I ain't worried about it. I ain't in my head about, oh, is that a dog? No, I see the dog and he coming toward me. This is right now. It's imminent danger, especially if you're scared of dogs, right? This is right now. It's no longer, oh, did I turn the stove off? It's walking in and seeing the fire going up the walls. I'm in immediate fear, immediate danger. That's fear. Okay? Y'all picking up what I'm putting down? And then anxiety. Anxiety is a mix of both worry and fear. So you have the thought, you feeling it, you're future focused about what could potentially go on or what this potential problem could be in the future, and you're feeling away. Right? So what if I mess up on my presentation tomorrow? So that's the thought. And then your stomach start going. Now you feel like you got a boo-boo. Whatever it is, whatever it is for you. Or your chest gets tight. Or you're having a hard time taking a deep breath because you rapid breathing. But see, your brain, because it's pre-wired that way, it's thinking, oh, it's a threat. Let me get her some more oxygen. We are in fight or flight. Let me supply this. But that's not what you need. But our bodies are already wired this way. But because now that you know this, you can intervene. You can help yourself in that way. Okay? Let me know if I'm going too fast. If you have any questions while we're talking, please let me know. Okay? Has anybody ever experienced, now that we're looking at the difference between worry, fear, and anxiety? Okay, good, Stephanie. I'm glad it's making sense to you. Thank you so much. I hope it's making sense to many of you. And if you don't mind sharing briefly, anyone, a time where you clearly, now that you're thinking about the difference, you clearly see, oh, that was worry, but I was calling it anxiety. You can either just thumbs up. You don't have to write it out. You can just thumbs up if you've experienced that. Because I think that's what we do sometimes. We take this word that we hear and people use all over the place and we apply it to ourselves and we think that's the same. Mm-hmm. Okay, good. But now we know. Sometimes you're worrying about something. So let's have the right and the most appropriate language for what we're experiencing. Let's call the thing what it is. Because we could be putting some on us that that's not the case. Honey, who was this? You experienced it more than you would want to admit. McCoy, did I say that correctly? Absolutely. And so have I. Look, we all living here in this 3D world. Yes. And sometimes say, oh, girl, I got anxiety or something. No, ma'am. You just worried about that thing. You in your head about it. It doesn't mean that you have anxiety. So be mindful. And don't say, again, let me repeat this. I see a few more people came. Don't say, I have anxiety. No, I experience anxious feelings. Okay? That's what you're doing. You're experiencing something. We're all in this human experience, right? And we experience emotions. You don't have. Stop putting that on yourself. And again, let me clear this up. It's not to say that people don't have clinical diagnoses. People do have clinical diagnoses of anxiety. But even my clients who are clinically diagnosed, you don't have to say, I have that. I experience this. Right? I'm glad y'all talking to each other. And I'm glad, Turtle, you like that. Because that's real. We got to be mindful of how we talk to ourselves. Because especially with worry, and because anxiety is a mixture of worry and fear, we are in our heads a lot about a potential thing that hasn't even happened, right? We're in our heads and we overthink. We're talking ourselves to death about what all can go wrong. All of the what ifs. It's cognitive. And then all of that cognitive, all of that overthinking about what the problem could be or how this can go wrong or how this is not going to work out, then begin to make us feel a way. And then because we feel this way, oh yeah, I see you, Del Ray. But because now we feel this way, we begin to move in a certain way. So we got to break it up. And that's why, this is getting a little ahead of myself, but that's why CBT, cognitive behavioral therapy, is so good for anxiety, because we got to start with the thoughts. What are you thinking about yourself or about this situation? What are you telling yourself about this situation? Because that's what's leading to what you feel about it. And it's going to ultimately lead to how you respond or how you act. You see what I'm saying? Okay. So that is worry, that's fear, and that's anxiety. I'm trying to make sure I'm looking at my notes and reading these. Okay, you try to reverse it. Think about what can go right. Oh, but it still produces anxiety. Okay, we could deal with that. But yes, that is what you should do, though. Instead of, oh, what if I don't do well? What if I do? What if I go on here? See, for me, before even coming on live, I do this all the time as far as working with my clients. But now it's more eyes at one time. Like me and somebody was just talking about speaking in front of people. My mind started to try to tell me, well, what if nobody shows up? What if you don't know what you're talking about? I know good and doggone well I know what I'm talking about. I do this every day. But the mind. So I had to silence it and I had to tell myself, well, what if the right people are in there to hear what they need to hear? Maybe I'm just the messenger. Hey, Marlon, maybe I'm just a messenger for one person. And if that's the case, okay, go and show up and be all right with it. Because what if it goes right? And if I get to choose what I'm going to think about. I'm going to choose the thing that make me feel good and not the thing that causes me so much stress and so much angst. And no, I'm going to change the channel. I got the remote. This my brain, right? And we do have those things as automatic thoughts. Yes. But as soon as I recognize I'm thinking in the wrong way, a low vibrational way, it's time to change the channel. I can't entertain this. You see what I'm saying? We can't. We got to change it. So what if it goes right? What if it helps somebody? It don't have to help all 22. It can help too. I'll take that. Because it's not about me. It's sharing the information, and it's about you receiving this information and making use of it. So anyway, that probably did what I said I wasn't going to do, and it took me off a little bit. But that's what we have to do. We got to challenge these negative thoughts or these automatic worrying thoughts. And if it makes you anxious, you just keep telling yourself that. Who said it to me? Hey, Kristen. Cutie. Yeah, keep telling yourself. And then use some other skills that we'll talk about. And I could say like deep breathing and things of that nature. We'll talk about them later. But keep telling yourself, don't stop. Because those negative thoughts will keep coming. So why don't you be persistent? You keep fighting back.